So in this lecture, we're going to spend a short amount of time talking about core buildups. So in a situation in which you have a endodontically treated tooth, a lot of times the tooth is going to come down pretty broken down already. So you're going to have some missing tooth structure and possibly even some walls or cusps that are missing. So if you think about it, what we're trying to accomplish is we want to eventually get a crown here to cover the cusps here for cuspal support. So in doing so though, we got to replace a bit of this missing tooth structure here first to provide a foundation for that crown to sit on, and also to have some axial wall height to provide that retention and resistance form. So when we have this much tooth structure missing, it's important for us that whatever material we decide to put in here to replace that missing tooth structure, then it's going to be able to hold on and secure itself to the tooth. So basically the idea is that the fake stuff that you put in here to put this tooth back together, you don't want that fake stuff to start to dislodge or for that to come apart from the tooth. So whether you're doing amalgam or composite or a glass ionomer or any other core buildup material, one of the principles is you want to find a way to firmly secure that buildup onto the tooth. So one way in which we can do that is with this idea of a chamber retained core buildup. So in our sim example, we are going to use amalgam, but you can certainly use other restorative materials and follow the same principles. So when a tooth has been endodontically treated, a chamber retained core buildup should be considered to improve the retention of the core buildup material. So what you're looking for is multiple walls. So here we say 3 or more walls remaining with a minimum of a millimeter thickness of the tooth here to provide a solid foundation for the crown to sit on. In this case, they call it a casting. Okay. So if you can see here, you can see that this current tooth has sufficient walls so that if we put something in here, that there's not really a path in which that material can be easily dislodged. The other thing that's to our advantage too is that we can stuff some of that material down into the chamber, which also acts as retentive features to provide the dislodgement of that core material. So here's an example of a tooth that has been already built up, and we're using this chamber retained amalgam buildup to build up that tooth structure, so now it can help with the axial wall height for the retention resistance form of a crown. So as you can see, this amalgam, we packed it in and we let that set. So this amalgam is pretty securely embedded within the tooth structure. There's not really a way in which this amalgam buildup can be easily dislodged from the tooth. Really the only way to get this out is if you start to cut it into multiple pieces so that the individual pieces now have a path of dislodgement, okay, or path of withdrawal. The second part of this is talking about posts if we don't have adequate retention of this core material, and we'll get to that in a subsequent lecture. But basically the idea is if you can use the walls plus the chamber itself to hold the buildup material, then that's a ideal situation. If you don't have that available and you still want to do a core buildup, then you can augment that with a post. And we'll learn more about posts a little bit later on in the course. Okay. So one of the principles was not only looking at the number of walls, but at some point, because of the tooth breakdown, the internal walls of this tooth, you got to have a certain amount of thickness here. So from the chamber of the pulp chamber to sort of where your prep or margin kind of ends, sometimes you'll have a thinner sliver of tooth structure. You just want to make sure that nothing is so thin that as you load the tooth that it's going to be in area of fracture. So anytime you have a wall that is sandwiched in between the chamber and the margin preparation, you want to make sure that that is at least a millimeter thick, just for structural strength of the tooth. Another principle that we want to talk about is this idea of restorability. So let me take a pause here, and we'll dive into this idea that that root canal therapy is performed only after the tooth has been deemed restorable. So I guess another way to put it is the situation you want to avoid is you get to a tooth that has, let's say, a large amount of decay, and you end up removing the decay, and it turns out the decay had run into the pulp. So to really get the patient out of the pain and to correct that problem, a root canal is necessary. So let's say you do the root canal and they spend, all this time and money in the chair getting the nerve taken care of. But then when you go back to then restore the tooth with a build-up and crown, you find that you don't have enough tooth structure for that tooth or for that crown to really hold on to. And really the prognosis of that tooth turns out to be poor, and that we know that that crown won't survive very long on that particular tooth. Well, the patient's not going to be very happy because they spent all this time and money already doing the root canal first, and then later on they're told that they can't have a crown, or a crown won't last very long. So really, when you get to these situations where you end up needing root canal, you always want to determine first whether that tooth is savable, meaning can we sufficiently build that tooth up and then put a crown on it. And then if the answer is yes, then go ahead with performing the root canal treatment. So again, just want to highlight this picture. You want to remove caries, and you want to kind of be cognizant of how many walls you have left. Okay, so restorability of the tooth must be determined first. One scenario is, let's say the patient comes in, they're in pain. Well, to get them out of pain, you can perform pulpotomy and then send them home that day. So that gives you or buys you some time to determine whether that tooth is restorable or not. So remember, you're looking at the tooth structure left over after all the decay has been removed. Okay. So if you look at this tooth here, you can see that, okay, after removing all the decay, this may not be a tooth that is viable for a crown, because you can see we still have a tooth fracture. And then if you can imagine doing a crown preparation on this tooth, well, you're not going to have a lot of natural tooth left, because remember, we're grinding circumferentially around the tooth. So really all you're left with is all the buildup material that's just going to be in the center here. And you may not have a good outcome or for the long-term survival of the crown. So let's get into this next slide, and just some things to consider when you're determining restorability. One of the things I look for is just the number of walls. So remember, a buildup needs to be able to be retained. So you're kind of thinking of, well, once I prepare it for a crown, is that buildup still going to be able to stay within the natural tooth structure? So the number of walls is going to help. The wall thickness is going to be a determining factor, in the sense that you don't want anything too thin where the crown or the tooth may fracture. And along with that too is the height of these axial walls. So the taller the walls, then the easier it is for that buildup material to stay on, and also for that crown to stay on too, when we're talking about retention resistance form. Okay. So again, the whole principle around determining restorability is, can we get the core buildup to stay on the tooth? And also, do we have enough tooth structure left to withstand some of the forces? Okay. So if the tooth needs endodontic treatment, then that kind of puts us behind the eight ball, in the sense that you're hollowing out the tooth structure. So anytime you hollow out the tooth structure, naturally that tooth becomes weakened due to its structural integrity has been slightly compromised. So that would be at a poorer prognosis if you were to compare that to just another tooth that didn't need a root canal but just had a large cavity that needed to be filled. Okay, so it's going to be hard to simulate every single scenario that you're going to encounter in the simulation clinic. So a lot of this restorability conversation honestly really happens down in the clinic floor. This is something that just needs experience and multiple instances with differing tooth and differing loss of tooth structure and clinical experience to really help determine what is going to be a good prognosis or not. So this idea is going to be harder to simulate here, but I want to introduce the concept. So when you're thinking about treatment planning certain cases, that progression runs through your head, where restorability of the tooth first, then think about root canal treatment, because we want to try to save the tooth. Okay. So let me just finish up with these last few slides. So anytime you expose the chamber, of course you want to use a rubber dam to prevent any contamination. Okay, so in the sequence, once you get once you decide that a chamber retained core buildup is sufficient, then what you can do is just put a Toffelmeyer or however else you want to band the tooth, and then you can fill that with, in our case, amalgam, but really can be any other material. With amalgam, you just got to be a little bit more cognizant in the sense that the amalgam is retained solely by mechanical retention. Whereas composites, you have the luxury of some dentin bonding, which is going to help a bit with that composite sticking to that tooth. Okay, we know dentin bonding isn't perfect, but it's still a step up from amalgam. Okay. All right, so when you do this amalgam retained core buildup, you just want to see that the amalgam is extends into the pulp chamber, because that is also another form of retention. Okay, so not only the walls coronal to it, but the actual chamber itself can function as walls and help prevent that core buildup from coming out. Okay, so once you build it up, then of course this is going to need a crown for cuspidal protection. You can see how much of that tooth structure is lost. So you end up doing our crown prep, and then you can then seat a crown on top of it. Okay, so that's the concept of core buildups. In our case, we're going to have you do specifically an amalgam, a chamber retained amalgam core buildup in your simulation clinic.